Okay, so I wanted to give a little update. This is day 6 post-surgery, and I wanted to give an update a little bit earlier, but I've had a pretty rough past couple days. I obviously can't shower, so I'm finally got to wash my hair last night with my mom's help, standing up in this contraption thing. It goes over my head. It was crazy, but I feel so much better. And just pain has been I'd say the first 3 days I was pretty much consistent on my pain meds. Every 3 hours I was taking them, and just barely getting up other than to just use the bathroom. That's another thing. I wasn't able to feel the urgency to go to the bathroom, or really if my bladder was being, if it was full, just because of the anesthesia lingering in my system, and it just needed time to wear off, and then having the catheter, all of that just needed time to kind of get back all the nerves, sensations, and everything. So I'd say maybe day 4, 5, really, I finally was able to get all those sensations back. I have what's called a JP drain system in, and I'll show you that in a minute. That's really what's kind of been giving me my most trouble, more so on my right side than my left side. Where they have it stitched in to my incisions to hold it in place. It's just kind of it's like, I don't know how to describe it. It's pretty much like, it feels like it's scraping or poking against my rib. It's very uncomfortable. If I'm sitting up straight, I have to kind of contort my body to one side to try and stretch out my abdomen, so it's not just sitting there jabbing in. But I'll show you that in a minute. So okay, let's see, I'm gonna stand up now. All right, so they have me in a compression band, and let's see if I can show you everything here. Alright, so this is the compression that they put me in after surgery. It just goes all the way around. You can see here Velcro's in the front. This is my drainage system, so they actually have these drains going all the way up into my incisions on both sides. They're stitched in, and they come around. Kind of nasty, I know, if you don't really have any kind of medical background or anything. It's kind of gross to look at, but my drainage is still pretty red. They said that they wanted my drain to really kind of be more on the yellow to clear side by now. They said by day 7 that's what it should look like, and it's, I don't know if you can really see in this light, but it's still pretty red, and pretty thick. So I'm just kind of watching that. I have to measure that daily and just kind of keep track of how much drainage is coming out on both sides. And I have to kind of I don't know if it's called priming my I know the term, I just can't think of it right now, but basically I have to push, I have to hold here at the top and just push the fluid through the drain into the bottom, so it gets rid of any clots or anything that can kind of cause this to be backed up or whatnot. And it's the same on the other side, and just clips onto the bottom here. And then, okay, so this is what's known as a soft pulse. This thing that makes me look like Iron Man. My son calls me Iron Man. It's flashing. I don't know if you can see it, but every so often it'll flash. He wants it. I don't know. But anyways, this whole thing is supposed to wrap around the whole area that's been worked on. And what it does is it basically provides like electrotherapy, which helps with pain and healing. Kind of like a TENS unit, if y'all know what that is. Kind of helps like with muscle spasms and stuff. So I'm just supposed to leave that on for, I think it's like 8 or 9 days. I don't know. Maybe when I get my drains taken out, I'll take it off also. This over here is where they went through my armpit. See if you guys can see this. Obviously it's still bandaged, but you can see some of the bruising over here. All of this area on me is still numb. They said that I could stay pretty numb for a while before I get some sensation back, and it's possible that I may not get all of it back. But they had to go through my armpit to get to the lymph nodes to remove that. So I had to change this dressing, I think it was yesterday, and my incision is probably about, I'd say, that long. Yeah. It's all sutured up and everything, so as you can see, it would rub right against that area, so I'm just kind of keeping the gauze and tape in place as long as I can. So, yeah. So that's it right now. I'm okay. I haven't had to take any pain medicine today. I'm in nursing school, so it's been really rough. I came back, I had my surgery last week, Thursday. Came back on Monday to go straight into clinicals. That was pretty rough. Luckily, the nurse that was my preceptor, she understood, and so she just let me pass meds like pretty much all day. But it's been rough. And then Tuesday was my final. So it's just been like dealing with the surgery and pain management up until now. Really, I haven't had to take any pain medicine. Trying to study, that was a joke, but thank God I passed my final. I've made clinicals so far, so I don't know. It's just been like one thing after the other, but I'm just so thankful that these are out. Oh, and I wanted to show you also my implants. They are in a bucket, and I'll do my best to show you. So let me go get those really quick. Hang on. Okay. So, I was able to get my implants. They asked me if I wanted them or if I wanted to send them out, and I said no. They just sent my capsules to the lab, but I wanted to keep my implants. Okay, so we knew ahead of time that the left implant was ruptured, so it was leaking. I'm putting on gloves just because the containers that they place them in are just that. They're just containers. They're not like pre-packaged. The implants are just basically lying in the bottom of this jug. My jugs are in a jug. But, so I don't really want to touch these as they were in my body, and they still have a little residue of blood on them. So, I'm really not going to even really handle them after this. I'm just going to keep them. But, for the video purposes, I want to be able to show you what was inside me, and just what they look like and all of that. So this is the right implant. They were both 375 cc's and smooth saline. So the smooth is just basically the shell You have smooth and textured, and I chose to have smooth. And of course, saline is the filling. So I'm going to remove it out of this bucket. This is the first time I've actually held them, so this is kind of like a little crazy for me. But, okay, and you can see obviously there's still like some blood and stuff on there. But, okay, so this was the right. And I don't know if you can see how big that is. I mean, it's pretty huge when I put it up to my body, and maybe this video is not really showing very well, but like that's really large. And this one actually was starting to leak as well, nowhere close to the left side, but and so right here in the front you have what's called the valve, and that's basically where they fill it once it's placed inside of you. And if it's saline, they fill it from the valve. And then back here, it's just basically the manufacturer information and the size and the serial number and all that. So that was the right. I'm going to put that back in there. It's just disgusting, in my opinion. It's so gross. Okay. And then we'll open the left. And the left is going to be pretty much like really deflated. You'll be able to see this. I couldn't believe it when I was looking at it. It's like folding in half and everything. It was crazy. But they actually said that my capsule around the left one somehow had torn, so it was actually ripped, which was causing a lot of inflammation and stuff in that area on top of everything else. But alright, so this is the left side. Yeah, my left implant. And okay, so like immediately holding it up, you can see already it's like folded over on top, and like it can't even hold its shape like the other one. Like this is just like ridiculous. I don't know if you can see all that creasing going on. See how it's just like folding up in the middle? Like it's lost a lot of volume. But this was the left side, and again you can kind of hopefully see a little bit how that sat in there. I mean, it was just huge. I can't believe that they were able. I'm really curious to see how big my scars are, but yeah, again you can just see how deflated that is. It's just folding over and rippling, and you could actually, what's so crazy is when I had it in, you could actually feel all of that rippling and creasing underneath my skin. So like if I had bent over in any position like this, you would actually be able to palpate the skin and just like barely push in and feel the bag just crinkling, like pretty much it was in my hand now. Just really crazy. But my dog's in here, he's curious. He's like trying to see everything that I'm doing. I don't know if you can see his head or not. I'll give you a shot at him. There he is. He's just curious. Hi, Duke. So that is basically everything to date. Hopefully I caught everything. I don't know. I'm sure I missed some things, which I can give another update here in a couple days. But so for now, I'm just going to keep monitoring my drainage, watching for that to change, and probably increase my fluids. Keep a close eye on, the color and all of that, and my pain as well. And my anti-inflammatories will probably take that as well. So, yeah, I think that's everything I've covered. So, again, if you have any questions for me, please feel free to comment below, and I will get back to you as soon as I can. I pretty much try and lay in bed as much as I can and rest in between trying to study and go to school and clinicals and everything else. So I will have another update hopefully maybe this weekend, And until then, all right.